Okay, I think we're live. It is 5:02 and I will call to order the September 16th meeting of the Quality of Life Committee. And if we could get a roll call vote, that would be great.
Of course. Councillor Jamie Cassett-Sanchez.
Here.
Councillor Mike Garcia.
Present.
Councillor Chris Rivera.
Here.
Councilwoman Renee Villarreal.
Present.
And Councillor Carol Romero Worth.
I am here.
Perfect.
Thank you. I will now entertain changes or a motion to approve the agenda. Are there changes from anyone?
Move to approve.
Second.
And if we could take a roll call on that.
Of course. Councillor Michael Garcia.
Yes.
Councillor Chris Rivera.
Yes.
Councillor Renee Villarreal.
Yes.
Councillor Jamie Cassett-Sanchez.
Yes.
And Councillor Carol Romero Worth.
Yes. And so moving right along, are there items on the consent agenda that the committee would like to discuss? And if there are none, a motion would be in order.
Move to approve consent agenda.
Second.
And Jennifer, again, a roll call.
Councillor Chris Rivera.
Yes.
Councilwoman Renee Villarreal.
Yes.
Councillor Jamie Cassett-Sanchez.
Yes.
Councillor Michael Garcia.
Yes.
Councillor Carol Romero Worth.
Yes. All right. So with that, are there changes to the minutes of September 2nd of this committee? And if not, a motion would be in order.
Move to approve minutes
Second.
as presented.
Second.
And we have a motion and a second. Jennifer, another roll call would be great.
Councillor Chris Rivera.
Yes.
Councilwoman Renee Villarreal.
Yes.
Councillor Jamie Cassett-Sanchez.
Yes.
Councillor Michael Garcia.
Yes.
Councillor Carol Romero Worth.
Yes. Okay, fabulous. We are moving now to we have no action items for discussion tonight, but we do have a presentation from the Children Youth Commission Strategic Direction and Measurement of Outcomes. And we have with us our Community Services Director, Kira Ochoa, and some other special guests. And Kira, maybe I'll let you introduce them. And I don't know how you want to approach this presentation, so I'll just give you the floor and you can take it away.
Thank you, Madam Chair, councilors. I'm very happy to be able to turn the introduction of this presentation over to my Youth and Family Services Division Director, Julie Sanchez. We wanted to present this tonight to you, both to give you a more of an in-depth view of what the Children and Youth Commission does and how they do it using a framework called results-based accountability, which I know some of you are familiar with. And also just to kind of plant the seed as we begin to define how to measure quality of life in Santa Fe, what indicators we want to use, what indicators this body would like to use, how we go about strategically planning to have high quality of life in Santa Fe. And I think this is a nice microcosm for how we've done that in the Youth and Family Services Division and Community Services using results-based accountability. And with that, I'll turn it over to Julie, who will introduce our presenters.
Thank you, Kira. So, Madam Chair, counselors, my name is Julie Sanchez. I am the now official Division Director for Youth and Family Services, which feels really good to say. I have been overseeing the Children Youth Commission now for a little over 4 years. I'm really happy to also introduce both Natalie and Ariana, who are with Aspen Solutions. who've been assisting the commission for the last, I want to say 2.5 years on data collection on results-based accountability. They've been a really integral part in this work. And so I'm really happy to have them be co-presenting with me. Just some very, just a very brief background on the commission. It's one of the oldest standing commissions in the city of Santa Fe. It started, and I might be dating myself, but it started around the time I was born, which was 87. So it's been a really long, a long-standing part of the city. It's currently made up of 10 members. And each of those members represents different focus points in the city. So we have the arts represented, we have homeless and runaway youth represented. We have representation from different districts. So we've really tried to make the board as diverse as possible. Something new that happened over the last year, which took a lot of work, was actually merging the Regional Juvenile Justice Board into the work of the commission. What we saw was there was a lot of duplication in what the Regional Juvenile Justice Board was doing. And it seems like things would be working much more efficiently should those two boards come together and work together. And really it's been a process. We have two fantastic co-chairs who've been really moving the work forward. And we also receive additional funding for that through CYFD and their juvenile justice funds. So that's kind of like the current history of the commission. The results-based accountability work and the data project really started under Chris Sanchez, who was my previous supervisor. And I really worked with him to bring it kind of to the forefront of the work of the commission. A lot of the work is now driven by an annual strategic plan, which focuses on data and different things that are happening within the community. So for example, some of the things we can expect for future data is probably looking at youth violence, considering it's been so prevalent within our communities recently, and would probably be a funding priority in the future. We also look at things like youth homelessness. We look at other data points around food insecurity, drug and alcohol use. And so the city funding is really geared towards creating an impact in those data points. And Natalie and Ariana will speak a little bit more to that. It's been a huge pleasure to be able to transform this commission. It really used to be kind of a feel-good funding board. So if you had an agency that was doing these really sweet projects, a lot of times agencies would come to us and say, we want money because we do such great work and our little projects are so sweet. We realized that that wasn't actually having an impact in our community in the way that we wanted. So it took about a year to really transform the commission to being more impactful with the dollars, being more data driven, being more transparent in the way that they do their work. And again, all of this work is driven by a strategic plan. That strategic plan is introduced to the governing body for your input and guidance. Because of COVID, everything has been really delayed, but that plan was created in January of this year. So hopefully we'll be able to get that to you for discussion and suggestion. And with that, Ariana and Natalie, I don't know if you want to pull up your PowerPoint so we can start going through some of the data, and if you just want to introduce yourself.
Yeah, hello. I'll start sharing my screen here, I think. Let me know if it pulls up. Thank you so much for having us this evening. It's really an honor to work with the commission and to be presenting with you today. I'm Natalie Skogerbo, owner of Aspen Solutions. We're a data consulting firm and evaluation firm. I do a lot of work in substance abuse prevention and behavioral health and youth development. So this project with the city has just been super fun. Ariana, do you want to briefly introduce yourself?
Sure. So I'm Ariana, and Natalie and I have been working together for about 10 or 12 years now, and really excited to be here with you all. So thank you for having us.
Julie did a great job of introducing sort of the scope of the project. So briefly tonight, what we will touch on is kind of emphasizing how we use data for planning across a division, and then how that's kind of infiltrated down into the agencies that are funded. We're going to provide a brief overview of evaluation and the approach that we use in working with grantees to develop results-based accountability measures. So a lot of people get scared when they hear the word evaluation because they think that it's really critical and we're looking for all the bad things. But really its focus for us is about program improvement and figuring out what's working, how to improve that, develop systems and processes for agencies to monitor their progress, to determine if they're meeting their desired outcomes or not, and then use that information to plan for the future and to make policy and practice recommendations. So there are lots of different frameworks and theories that can be used in evaluation, and the city has really chosen to emphasize the results-based accountability framework. And Ariana will go over that briefly with you.
So results-based accountability has been adopted by many funders here in Santa Fe. So some of you are probably familiar with it. It's really focused on 3 different questions, which is getting at how much are we doing, how well are we doing it, and is anybody better off? And the City Community Services Department adopted this to really start focusing on using data for planning and achieving data-driven outcomes. So these are the 3 basic questions. And the ultimate goal here is really to turn the curve, which is some of the results-based accountability terminology. And the idea is that you focus on a specific issue and put efforts toward that, such as addressing heart disease rates in Santa Fe. And then you're really putting a lot of effort toward that to sharply change and decrease the heart disease rate in Santa Fe. So that would be an example of turning the curve. So one of the things that in results-based accountability we do is create these performance measures that get at these 3 questions. So level 1 is really that first question of how much did we do? How much service did we deliver or provide? And so we develop these performance measures for each of the agencies that we work with and are funded by the committees. And so some examples of a level 1 measure for agency would be unduplicated participants served by a navigator, or total number of youth served. So those are some examples of level 1 measures that really start to get at that question of how much did we do? And then level 2 is getting at the how well did we do it? And this 2 examples of performance measures for that could be the average number of case management hours per youth and the number of referrals accepted. So you have a sense of how much work is being, how well the work is being done, and are people actually getting the services they're being referred to, for example. Level 3 and level 4 both focus on that question of, is anyone better off, in different ways. Level 3 is focusing on that quantity and quality of change for the better that is produced. So an example of that could be youth with reduced depression, youth with reduced arrest. So you could see by those 2 measures, some change has occurred. Youth are doing better with their mental health and the arrest rate. And then level 4 is getting at, did we improve skills, attitudes, behavior, or circumstances? So these are similar to the level 3, but we're looking at the percentage of the youth in the program that actually reduced their depression and the percentage that reduced the arrests. So that's a quick overview and some example performance measures. And we could do a whole presentation on this another time, but you get kind of the idea and the flavor of what those performance measures are. And we'll go over kind of the benefits and the challenges of creating these performance measures.
Yeah, so prior to the Children and Youth Commission really focusing on this framework, agencies were reporting back to the city a huge variety of data and information that the city then had to cull through and try to figure out, what does this mean? Are they meeting their scope of work? Are they doing the services that we wanted to pay for? So the agency level performance measures really work with the agency about what are they trying to improve and how is that aligned with their agency mission. A lot of agencies did not have very good systems for tracking data or no systems in place at all. So figuring out what's going to work with you, with your agency and your workflow, and what systems you already have in place. What data are you already collecting that align with what the city is trying to do? Agencies have really been able to use their data to inform their programs a lot more since we've started working with them, so they can see if a measure doesn't make any sense or if it's hard to collect, and they can also see if something tells them that they're doing a good job. And before, they were just sort of spitting numbers back and it didn't have much meaning for their programs or their implementations processes. So that has been a huge outcome. We think that agencies are better able to talk about their outcomes, and they now have systems in place that they can report these data when they're applying for other funding. They can use it in marketing materials for their donors, all kinds of other ways that they're using these measures for their agency. A lot of agencies have challenges. As I mentioned, they didn't have data systems in place. They created their own evaluation tools, which often didn't get at what they really wanted to measure. You know, keep in mind, a lot of our agencies are small. They don't have dedicated budgets or staff to do evaluation. So just having us available to assist them with this, and sometimes even analysis and interpretation of their results is really needed, because they have a lot on their shoulders implementing their programs in the community. So that was sort of an overview of the agency level performance measures, and all of those agencies feed into the bigger, broader population level priorities that the city has identified.
So for the Children Youth Commission, there are 4 population level areas, and same for the Human Services. For the CYC, it's early childhood, supplemental education, and youth wellness and opportunity youth. And some of the examples of those population indicators would be like pre-K enrollment, prenatal care in the first trimester, graduation rates, protective factors such as supportive adults in their life, which is a really strong correlation with many positive outcomes for youth, as well as substance abuse and mental health for youth. And then for the Human Services, there's adult health, behavioral health, community safety, and equitable society. And some of the example of the population priorities there are chronic disease, fruit and vegetable consumption, depression, suicide, drug rates and drug use, homelessness, domestic violence, unemployment, and food insecurity. So there's a lot of different areas that are really being targeted here. And I think that's one of the really big benefits of using results-based accountability, because you can really structure it around these population levels and ensure that all of the agencies are feeding toward those goals. So there's some challenges and benefits about measuring population outcomes. Some of the things that are really beneficial about the population outcomes is agencies get to work toward that common goal. So in the past, as Natalie was explaining, agencies would just say, oh, we served 42 youth and 47 of them engaged in treatment. And then you look at another program that's doing similar work and they say, 100 of our youth are not using substances anymore. So those two aren't really comparable anymore. So it can be really helpful to have both those performance measures we were just discussing at the agency level, but how they connect in with that population outcome level. So you're talking about the same kind of goal toward decreasing substance use, for example. So there are also serious needs in the community, and using these population outcomes is so beneficial because you can see where the rates are really high. Natalie and I were just talking about a good example, and I can't remember what it was. Was it binge drinking?
I don't remember. I mean, I know, for example, our alcohol related death rate in New Mexico has consistently been the highest in the nation for several decades, and Santa Fe's is often higher than that. So that means that's a serious need that we still need to address, a persistent problem in the community.
That's what it was. Thank you. So just knowing what those population outcomes are, when you're just talking about data without understanding where it fits in with the population, it can sound really scary to say, 75% people have had this happen, but you don't really know what that means for the whole population. So having that really helps to address those really big needs in the community. And then data are validated and published by the Department of Health and the CDC. So these are really robust data measures and dependable, accessible, and I think the next one is actually comparable to other counties and states and the country. So you can really use these population outcomes to say how well are we doing compared to the state of New Mexico or the United States. And it also helps, population outcomes also help identify these emerging trends or priorities. So a great example of that would be the overdoses related to opioid use that kind of all of a sudden started increasing. And so that's an area where if you're looking at these population outcomes, you can say, whoa, that was a huge jump, and that's an area we need to focus on in our community or nationally. Challenges. So there are some challenges with the population outcomes. Sometimes the data are several years behind, and actually that's not sometimes, they tend to be always a couple of years behind because there's such huge data sets. It takes such a long time to do the data analyses and make sure that they're really those robust validated numbers. So right now we're looking at 2017, 2018 data, and it's not necessarily reflecting what's happening today in our communities. Another challenge is that data can be reported usually at the county level, but not at the city level. So it's harder to find city level information. The county, for our county and city, overlap enough that it's pretty substantial around our city, but that can vary. And then it can take years of implementation before you can really see that turn in the curve of the data that we were talking about before. So that can be a big challenge as well, because you don't necessarily see those changes in the population outcomes for sometimes 5 or more years. And then another challenge is that there's preset survey questions or indicators, which makes it difficult if we as a community really want to focus in on a specific indicator or piece of information in our county. We have to kind of compare it to these national questions that are already in place. So Julie started sharing a bit about the strategic planning process already. But a big piece of that process is really focusing on data and integrating data. I don't know, Julie, if you want to share more on that.
I think another, I mean, as Julie might be coming in, but another important thing about the planning process that the city really paid attention to what those other community partners and funders were prioritizing and trying to align with that so we could have a bigger community collective impact around those priority areas.
Thank you, Natalie. I was actually just going to say that part of the commission's makeup is other community partners, folks from Christus, folks from Ancorum, because we want to make sure that when we're collecting data and trying to make impact in the community, that we're also on, the same plane or level as other funders in the community.
And there's a number of data sources that are used during the strategic planning process as well, including like the community needs assessments that are done and as well as stories specifically from our agencies. And I think that that's really beneficial, and it kind of helps bridge that gap of that challenge we were talking about, where we don't have the real-time data of what's going on, but some of our agencies can tell us different spikes that they're seeing in their populations that they serve.
Yeah, and I think we saw that a lot this year, or actually, no, it was last year, around our homeless youth, because we have very minimal data on what happens with homeless youth in our community, because they generally are not available to do a needs assessment or be available to do the youth risk and resiliency survey because they're not in school. And so we heard a lot of anecdotal information from community partners. We also, at one point, had a homeless youth come into our office to talk to us about what they were seeing in the community. And so we, of course, take that back and have it be integrated as part of our strategic planning process.
Yeah, and I think this is just kind of building on that process of identifying key priority areas that we want to address and unify around. And so then once that's identified, then the city really selected agencies that could demonstrate they were going to work towards these priority areas. I think that's it. And I guess Julie mentioned a couple of examples of the homeless youth projects. And so that's another reason why identifying specific performance measures for the agencies is so important, because while they're still working towards, say, youth works and youth shelters, they're still working with a similar end goal, but their projects are so very different. So I'll do this really, really briefly, but sort of the process that we went through with the agencies to identify their performance measures. We did a lot of work ahead of time to get to know the agencies and what their goals are and what they're working on. We met with the agencies already with potential performance measures drafted, and then talked with them about how each of those would be collected. And if it was too difficult, we threw it out. We really wanted to rely on ease of and accessibility of the data. We provided a mini training on results-based accountability and evaluation, since a lot of the agencies aren't familiar with it. And over time, we really, revised the performance measures. The follow-up could vary from, providing them with a draft survey for their participants, or a spreadsheet, or, some sort of data system for them to collect their own measures. And then we developed a uniform template that all of the grantees use, and we pre-filled it with each agency's unique performance measure. So when they received it, it was something that they were familiar with, and they didn't have to spend too much time going back to their notes and looking at what they had decided. So that's kind of the process that we went through. I think that you have seen these slides in a previous presentation, but it's just reiterating some of the outcomes that we've seen from the agencies in the last couple of years.
Yeah, so some of these intermediate outcomes are actually specific performance measures for the agencies. And so one that we could highlight is the Sky Center. They served, this was in fiscal year 2019, and this year they also met the same goal. I think they might have reached more people this year actually with COVID, and served over 400 students. And about 87%, and this was again true for this year, who were admitted into the emergency room for self-injury did not return to the emergency room after being connected with Sky Center. And 64% decreased suicidal ideation and depression through their services at the Sky Center. So that's just a place where you can really see the impact that tracking the data has and what the results are from doing the results-based accountability approach with these agencies. And these are just examples. There's so many we could share with you.
Yeah.
That's a really good example.
And another thing about the Sky Center, they told us how as the school shut down and everything shut down during COVID, they had really big increases in referrals. So telling us that that is an ongoing and emerging need was really important to hear. Here are a few others, and also during COVID, our homelessness services had to just think on their feet so quickly and shift the way they did things, and kudos to the city as well. Thank you so much for that huge support in finding housing with the Midtown campus and everything else. I know that people worked behind the scenes to get hotels to house people. So there's just a lot of incredible work being done in the communities.
Definitely. And same thing with food access during COVID. And I think this is the Food Depot is such a great example. So last year they had distributed 2.2 million pounds of food over the year. And this is just where you could see the real-time data in Q3, which was when COVID hit. They distributed 2.6 million pounds of food. So just in Q3, they did more food distribution than they did the previous year. Over the entire year for this last year with COVID, for Q3 and 4, it was 3.7 million pounds of food distributed. So you could see that the need for food in our community is so extreme with that shift in COVID, and you can see that data really easily in these reports.
And if I can, I'm just going to interrupt you really quick. When you're talking about quarters, you're talking about quarters in the fiscal year, not in the calendar year, just to be clear.
Yes, thank you. I appreciate that, Counselor.
So we can share this presentation with you later. I think you're all familiar with the many, many challenges that have been experienced during this unique time. But our agencies really had a heavy weight to deliver these critical services in the community.
And collect their data.
And data collection became a really big issue as well, yeah. However, they also...
And obviously, I was saying, it's obviously not the priority to collect data when you're doing these kind of need services that are immediate. Starting to, do customer follow-ups and follow and track certain things just fall off immediately because the priority is that stabilization. And then the innovations, the COVID adaptations, as we've been calling them, have been so extraordinary, and we won't get into that too much either. You can look at this when we share the presentation, but people have done such incredible work expanding their service hours, even expanding services and collaborating across agencies, just incredible, incredible innovation during this time.
So if we think about the model that the Community Services Department has done, it could be replicated in other agencies and other departments. These are a couple of the principles. We really focus on what's already working in an agency and find what their gifts and talents are and try to strengthen those and build on those. Remembering that we live in a complex and ever-changing ecosystem and environment. And so being flexible with emerging trends, being adaptable when things don't work out with an agency, figuring out how to meet their needs. Remembering that they often lack time, resources, and expertise and have very small teams and are trying to do so many things within their agency. We've also heard from a lot of agencies that they find out that something is happening within their population. Girls Inc., noted that they saw a really big increase in substance use among their girls. And even in statewide data, the girls were exhibiting higher risk than the boys oftentimes. And so, trying to work through that with them and what that looks like, what that means, how they could adjust their programming. And the last one is really a streamlined system so that everybody is using the same framework. They understand why they're collecting the data they're collecting and how they can use it to inform their programming is really critical. Anything else on those, Ariana or Julie?
I would just add that piece of understanding why data collection and evaluation is so important has been so useful for the agencies. And one example would be literacy volunteers. Their measures that they collected before we started working with them were great. But when we started helping them define what they wanted to do with the data they were collecting, they had this light bulb moment of how useful the data was for them, and that they started to care about collecting it in a different way because it informed their programming and it informed what they were doing for their students. And that's the kind of importance of providing that education and support around using a framework like results-based accountability to help the agencies understand why it feeds into their ultimate goal. That part, I feel like it's just so crucial.
Yeah. So that's what we had put together. I know we blew through it really quickly, but I know we have limited time. So thank you so much. And if anyone has any questions, or we can take them now, or you can field them through Julie or contact us directly at any time.
Yeah, I think we do have some questions for you. Kira, if that's okay, is this a good time to take questions on this presentation?
Madam Chair, absolutely.
Great. Councilor Rivera, you have your hand.
Thank you. Thank you for the presentation. Natalie, can you go back to the slide that you had that had La Familia, I think at the top of it?
Yes, I can. I will share again. Sorry about that.
No worries. So who sets the result-based accountability measure? Is it us, you, or La Familia?
So the overall priority areas are identified by the city through their strategic planning process. And then we work with, Ariana and I work directly with La Familia to finalize those measures. So it's definitely a team effort.
And how easy is it to change the measurements?
We change them very frequently with agencies throughout the year, actually.
And this one just caught my eye because I think there have been some recent studies that show that A1C isn't a real good indicator of if you're gonna get diabetes or not. So are we able to really look at what we wanna measure, which is less diabetes, or do we want to measure the A1C? So not sure how the whole group comes together to decide what it is we're trying to measure, but just something that caught my eye.
Yeah, that's a really good point. They are specifically working with people who do have diabetes, and so they're trying to bring them back into control of their diabetes.
So these are specifically patients that are already either type 1 or type 2 diabetics.
Correct.
Okay. That wasn't clear. I thought it was just general patients trying to keep their A1C under 8. And again, realizing that A1C is not a real good indicator. So thank you for clearing that up. Appreciate it. And just wondering how easy or difficult it was to change the outcomes. Thank you, Madam Chair.
Madam Chair, Councilor Dubera, I just wanted to add that, the Human Services Committee, which is actually the committee that oversees the La Familia contract award, and this is true of the Children Youth Commission as well. Those are made up of community experts. Julie mentioned, community partners like the members of the hospital staff, but we also have community experts, doctors. We have a doctor now from the Indian Health Service who sits on that committee, as well as a former member of the Department of Health. So a lot of what happens is that, we have really good experts looking at some of these measures and asking great questions like you just asked around the measures, and then they are flexible because of that. So that's one of the strengths of having those citizen committees helping form the strategic plan.
Yeah, so Natalie cleared it up, and if you're measuring patients that are already diabetics and trying to keep their A1C under 8, that may be different than using A1C as a measurement of whether you're at risk for diabetes or not. So if that's what we're doing, then it's probably reliable and probably a good outcome to measure. So yeah, just wanted to bring it up. Thanks.
Thank you.
I'm muted. Counselor Villarreal, your hand was up next. You're muted.
That would help. Just wanted to thank you, ladies, for your presentation, and good to see you on the screen and see where we've been heading since this discussion about implementing evaluation measures had been a discussion, and it's great to see that it's now in reality. And I know how much work it is to do evaluations in my own job with the nonprofit sector. We just went through an evaluation process this year, and it was very helpful to kind of dissect where we need to go and what kind of things that are programmatic work especially. So thank you for that. I just had a couple questions. Well, some comments and then questions. I think the fact that you all combined the quantitative data as well as the qualitative data is extremely important, because numbers don't always tell you the full story. And so I think that has been helpful, at least from seeing your presentation. Can you elaborate a little bit more about that? Like what kind of qualitative data collection was helpful?
Yeah, absolutely. Probably our favorite question is about success stories on the report template, and Ariana and I both usually end up crying when we're reviewing the reports, because it's just the direct impact on and betterment on people's lives is just every quarter is amazing. So that's one thing that we definitely highlight when we report back to the commissions, some of those key success stories. Some of the partnerships are also really great. There was a just really cool partnership that happened this spring between the YouthWorks culinary program and Kitchen Angels, you know, and so these agencies are figuring out how to support each other. We definitely rely on the qualitative data. What else, Ariana?
I would add the progress and lessons learned section really helps illustrate some of the numbers. It gives the agencies an opportunity to explain. And a great example of that would actually be the LifeLink. They were working on trying to get some of their population into long-term treatment, working with some of the people who are homeless at the interfaith shelter. And the percentage of people who do end up in long-term treatment is so small. But that open-ended section is such an important part for them because they can talk about those challenges of getting that population into long-term services, which is totally different if you were comparing, say, Sky Center, since we're on this slide again, their ability to keep people in the long-term treatment and stay connected with their services is huge. They're able to do that because there's resources available to the clients that they serve. But the people who are homeless have a totally different level of challenges. So those open-ended questions of progress and lessons learned or feedback on what they're seeing in their numbers is so key for us.
Thank you. I'm just curious, when you're doing data collection or helping the agencies we support through our grants, how important the census is for their data collection? Is that a factor? And if you could talk about that and how this census 2020, just the level of importance, and I don't know how much they do use that. So maybe you could just explain a little bit more about that.
Yeah, I mean, we haven't talked in a great deal with the agencies. I know that they use it especially for grant writing and that type of thing. But I don't know, I can't think of a specific example that's come up. It was definitely on people's radar, you know, this spring and summer.
Yeah, in terms of specifically the data from the census being used in this process is pretty minimal, I would say. It's definitely used, as Natalie said, in some of the grant applications and those pieces. All of our agencies definitely understand why the census is so important, though. And a lot of the agencies actually were doing like extra recruiting and support for their clients to complete it. Yeah, I'm not sure if that answered your question.
Yes, yeah, I was just curious if the urgency to make sure their clients are supporting it and filling out the census and that they're doing that push. I know that you're not in that granular level of detail, but the fact is it also influences and supports their work and the needs. So I guess I'm hoping that the agencies we're serving are also feeling the urgency for that. I think the other question I had is just, I know we're looking at organizations that are providing direct service for the most part. And I was just curious if in the evaluations or the processes that you got to the level of dissecting community issues and looking at or getting into root causes and really digging into like systemic inequities versus just the reactionary things to like, this will happen. I mean, if this happens, this is the outcome, instead of like digging deeper. So were you all able to take kind of that level of, I know that really wasn't part of maybe the template or evaluation, but I guess I'm just curious about that because I feel like we don't always get to.
Yeah.
dig deeper.
Yeah, definitely. And I think the commissions really thought about that as well when they were identifying those priority areas, like looking at who in our community is really the most vulnerable, who is experiencing the most disparities. And that has been really folded in to especially the Human Services Commission with the social determinants of health screening. And now the children and youth are going to be also participating in that. So really looking at those vulnerabilities. I think, and a lot of the agencies have it in their own mission, you know, to address those root causes. And again, poverty and discrimination and those really huge issues need to take place across the system and across multiple agencies. And so they kind of rely on each other, I think, to make a bigger impact.
The Human Services specifically identified equitable society as one of their priority areas for that very reason. And I know part of the strategic planning this year for the CYC was really emphasized around equity and inclusion. And I think the commissions also really focus on funding programs that support our most in need in our community as well. So I don't know if Kara or Julie want to add to that.
Julie, did you want to say something? Can't see her, so I did want to add, Madam Chair and Councilwoman Villarreal, that, you know, the Connect project, which is has become kind of the umbrella strategy for both the Human Services Commission and the Children and Youth Commission, although it relies on essentially navigation, that one-to-one relationship with the case manager, navigator, and their client, we've also always seen it as having a goal of system change, both in terms of how funding flows into agencies that, you know, frankly, in some societies are not nonprofit. You know, they just, this is what we do. So how can we hardwire funding to these agencies with our small incentive funding at the city and now the county to say to the state, to say to the federal government, this is a safety net. This is a network intended to, you know, improve the quality of life, not only for the most vulnerable people, but for the entire community, because there are ripple effects when the most vulnerable people aren't taken care of. So one of the things that we've done in the Connect project is have, you know, monthly navigator meetings in which navigators, you know, there's only so much a person can do on an individual level when you don't have enough housing units, or when, you know, the funding source for these clients is capped at $775 a month, and we live in the, you know, so we encourage policy discussions around what's needed that come from clients and from the people that can advocate for them, their navigators, and the agencies themselves, because we ultimately feel like that needs, you know, we need to go upstream in terms of why we have these disparities in Santa Fe, and why, you know, social determinants of health remain some of the strongest indicators of A1C, for example, that we've got going. And I know this is a topic we could, you know, all probably enjoy talking about for a long time, but that's my point, that although these agencies are doing one-to-one work, and although the Connect project is supporting the one-to-one relationship and supporting the relationship between the funder, the city, and the agency, we ultimately would like to take this to a higher level. And I think this is something the Quality of Life Committee can help us with, as you hear all of these issues and think, you know, wow, what is a policy intervention that could instantly make life easier? The same way that, say, the seatbelt law saved more lives, you know, in the United States than almost any other public health intervention ever. So I think that's an interesting and really helpful question. Thank you, Counselor.
Thank you. Yeah, I think it's a lot more difficult to track and to evaluate that side. I really want us to go that direction even more. I guess more directly or more intentionally. And the other one was, there was a priority areas slide that listed some like prenatal care, and then you quickly went through it and I didn't get to see what were the other points listed.
This
That
one?
one. Yeah, that one. Okay. Prenatal care, school readiness, high school graduation, youth depression, and youth substance misuse. Okay. All right. I was just wanting to see what else was on that list. Thank you, ladies. I appreciate you.
Okay, Counselor Garcia, you're next in line.
Thank you, Madam Chair. Thank you, Kara, Julie, Ariana, and Natalie for the presentation. I really appreciate it, and learning more about the implementation and evaluation and the performance measure framework that's being set up. I think it really helps to make data-driven decisions, which helps to assess and helps just to make the work stronger. It'll also help to lead to make a more effective and efficient department. And as Kira said, it will help take the work to a higher level. I don't have any questions. I just want to thank you for the presentation, and I look forward to seeing the great work that is conducted and reported out through this process. But thank you for your time, and I appreciate the presentation.
Thank you.
Thank you.
Counselor Cassett Sanchez, I think you were next, and then Counselor Rivera.
Thank you. Sorry, I have a very friendly cat this evening. I apologize. Thank you so much for the presentation. I really get pretty nerdily excited about this stuff, so I really appreciate seeing this work that's going on. Would we be able to receive a list of all of the agencies, the indicators that we're measuring, just for my own interest and just reading into that? That would be wonderful.
Yep.
Great, thank you. I had a couple questions similar to Councilor Villarreal's questions about looking at prevention measures. So kind of comparable, Councilwoman was speaking about really root causes. I'm curious if any of our programs are currently looking at prevention, and if we are working at measuring successful prevention. I know, as Ariana mentioned, those can be complicated because they're going to be population measures, and they're going to be data's 2 years behind, and then we don't see results for 5 to 10 years. So, but do we have that process started on any of our programs?
Yes, we do. A lot of the agencies are really working on building those resiliency item measures that have been linked with reductions in youth violence, youth substance use, truancy. So focusing on building caring, supportive adult relationships outside of the home, having a teacher or someone else at school that believes you'll be a success, setting goals and plans for the future, planning to go to college or some other school. So they're definitely working with their students in these programs to build those buffers. And it's something that I'm really passionate about as well. So hopefully we can do more work on that. What else, Ariana?
I know that there's a lot going on with the homelessness piece.
Yeah.
Navigators are really working toward many different goals around that. So there's some pieces around that are definitely prevention oriented as well.
I would just add to that, certainly in the Children Youth Commission, almost every agency's work in some way addresses adverse childhood experiences, and either preventing adverse childhood experiences or mitigating, them once they happen. Gerard's House comes to mind, and all the work we do with children who've experienced grief and loss. And we know that, on the front end, if we invest in prevention of adverse childhood experiences, which have been so closely linked to poor health outcomes, terrible behavioral health outcomes. We are doing really strong prevention work. And, you know, if we had lots of resources to do evaluation, we would do, you know, longitudinal cohort studies of the kids that start out getting all these great services and how that looks at the, you know, when they are adults. And, you know, we know from national studies and national work that that is the really important work of prevention. So it's powerful that the city has committed, as early as, what was it, 1987? I've never heard somebody say, by the way, I'm dating myself, I was born in 1987. It's like, you must be kidding me. But anyway, so sorry, focus on. So from that time, the city and the governing body recognized that by investing in the youth of Santa Fe, we were going to be investing in the adults of Santa Fe, you know, and we've done that, I think. And that's something to really look at and to continue to invest in my opinion.
Yeah, absolutely. Thank you. I definitely would agree, because it's having the data to show for it makes the argument 20 years down the road that that we need to continue this work. So that's really important for me in terms of planting those seeds to ensure that it continues past you know, our times here sitting in these seats and the the individuals that are doing the work now. So I'm glad to hear that there's already some of that data taking place. I was also curious about, you know, some of our agencies do have similar outcome goals. And are we able to really compare and contrast the success of programs? Are we essentially measuring the same indicators across programs that might have similar goals?
The answer is sort of yes and no, because there's such nuance in each of the programs. Really, at this point, and Natalie can jump in, I don't think that there's any two programs that are doing exactly the same kind of services at this moment. In the past, we've had a couple programs that were doing that, but often they're grant proposals, and when they get selected for funding is because they're doing slightly different things. So they might be contributing to the same population area, but their program measures are actually slightly different, because one program is to increase skills for employment and another program is to decrease depression, even though they're both contributing toward youth wellness, if that makes sense.
Yeah.
And I guess that kind of brings me to my second question, which is, or third question. Sorry, 1 second. That has to do with, I'm so sorry. My husband's knocking on the door and I'm telling him, use your keys, I'm in the meeting. So it's a ruckus household right now. You know, how do we have a way of measuring compounded impacts for potentially groups that are serving the exact same individuals? And I know that that's really hard to do. And so I'm not sure that we have the way, or you know, is that part of Connect? But if we have somebody that is in two different programs, are we able to show how being in both programs might impact outcomes as opposed to one or the other?
That's such a great question, and I think feeds right into the Connect program. It's something that the city, the department, sorry, has been working on for a long time, is trying to figure out how many of, you know, the kiddos are overlapping in these different programs, and what's the benefit. And so the Unita system that the city is using is going to be such a great way to be able to track that. And hopefully we'll be able to pull some really interesting data from being in multiple programs and how those programs coordinate together.
Yeah. Currently, there's not, or previous to that, there hasn't been a shared data system, and most of the programs kind of protect the identity, so they don't share that with others. And so, yeah, we would love to look at that overlap.
Yeah, I definitely understand the complexity with often the an anonymity piece, but I'm happy to hear that potentially with Unite Us that will be an opportunity that we can look at. So those are all of my questions. Thank you all so much for this work. It's really so important, and I'm very excited to see how much we have moved in this direction from you know, what Julie Sanchez said at the beginning of, you know, sometimes things feel really good, but they're not getting us the outcomes that we are really going for. And so our ability to measure that is so incredibly crucial to the work that we know needs to happen. So thank you all for your efforts and for your presentation this evening.
Thank you so much.
Councilor Rivera, you're next.
Thank you, Madam Chair. So I think we all read in the paper day before yesterday and today, I think, about a young boy that died of cancer. He came from sounds like an immigrant family, and there may have been some question about whether they realized that money shouldn't be an issue. So I wanted to know, Julie, if we had any of these programs that we fund, or if there are any, is there any funding available to really educate the immigrant community that there are programs out there to provide funding so that something like this never happens again?
So Madam Chair, Councilman Rivera, so we do fund agencies that work in the immigrant community, and they do a lot of advocacy, especially around knowing their rights. But specifically to health, nothing really comes to mind. It's something that is really important, and it's something that we should focus on. So thank you for bringing that to our attention.
Yeah, this story sounds like they didn't have the income available and decide to use sort of herbs and other medicinal methods for trying to treat, which clearly didn't work. So if we could find something to educate specifically the immigrant population, which is a lot of them are in my district, that may help, again, just with education, I think that would be helpful. Thank you, Madam Chair.
Madam Chair, Councilor Rivera, could I speak to that for a second? I read that as well and had similar thoughts, so thanks for raising that. I think that the other promising avenue here is that stronger relationships with the schools to participate in the Connect program, so that, you know, school employees and staff that see and work with kids every day can also be sources of referring families and children to resources. You know, as a former indigent program manager, the county, I thought, well, why didn't they go to La Familia, you know, or what, you know, why didn't they know about that? And you're absolutely right that I think, you know, and actually Councilwoman Villarreal's question about the census brings up an interesting thing. You know, when you sign up for benefits at Income Support Division, they ask you if you're registered to vote. And I think we can build in some of those sort of education / advocacy questions into the navigation network. We do a monthly trainings with our over 100 navigators in the city and the county. And I think just using that as an avenue to make sure that they're educating everybody they're coming in contact with is important as well.
Thanks. You know, unfortunately with this administration, the Trump administration has put some additional fears into our immigrant community, and I think that probably played a part into it. So I think when it comes to health and life and safety, that shouldn't matter. And I think just making our immigrant community aware of that, I think, is really important.
Thank you, Councilor Rivera. All right, I do also have a few questions. I want to take this opportunity again, because we have the Quality of Life Committee and we have this ability now to bring some of this work to the surface and help people understand the inner workings of how the city interfaces with the community and the community's need, and trying to make an impact on some of our systemic and long-term problems that really do affect the quality of life of people in the community. The Children Youth Commission, could you talk maybe briefly, Kira, about how that structure works, how often they meet? You all mentioned a strategic plan, and maybe Kira, it's not you, maybe it's Julie, whoever's best to help us.
I'll ask Julie to answer that because she's got.
Yeah, so sorry, I didn't mean to misdirect the question. But just to give us a little bit of information about how the Children and Youth Commission works, and maybe the strategic plan, how often that plan is revised, and what its purpose is, and that kind of thing. Just a little background information, a little foundational information.
Yeah, so the Children Youth Commission, Madam Chair, is roughly about 10 to 13 members. They range, because it's the merging of both the juvenile justice and the commission, they range in expertise from infant issues all the way to juvenile justice. They meet pretty much every month, although now with the new memorandum, their meetings are on hold unless there's something pressing that they need to meet on. The strategic plan is reviewed every year, and it depends on how much change goes into what the new strategic plan is going to look like. So if there are ever emerging issues in the community, they would take that time to get data and update the strategic plan. If things are just kind of, stable, and these are the data points that the commission wants to continue keeping track, then they'll do that as well. A really interesting point is the commission used to track park data as a part of school success for young people. And so because as you know, park is no longer a part of school testing. That was a revision that we had to do this year in the strategic plan. And the strategic plan really is what is going to be driving the funding decisions of the commission. And so agencies are invited to come to a talk, which Kira and I did earlier this year, around the priorities, around what the data points are going to be for the commission, and then kind of the overall strategy, which we talked about being navigation. So all the agencies have an opportunity to come and hear us speak about, and including Natalie and Ariana, about the new priorities of the commission. And then there's opening for questions. So we tried to make things really transparent and involved with the agencies as much as we can before we actually release funding. So that's kind of the general process. I hope that answers your question.
Great. Mostly it was just to get a foundation of information out for people who might not be familiar. So it comes to the council, and because of the whole COVID piece, it has not come to the council this year. Is that correct?
Correct. So usually it would come to council at the end of March. So of course, that's when we had our big shutdown, budget crisis.
Yeah, we've been a little preoccupied with other things. So is that something that we'll be seeing, I don't know, before the end of the year, or will we wait until March next year?
So we'll absolutely have it a part of a presentation. Probably, I would say mid-October, when the funding recommendations come. Generally, our process is that we have the strategic plan done by the commission. It's voted on. We present it to the public in case there's any changes or anything we need to take into account, and to also inform public and agencies about the new direction of the commission. Once we're done with that presentation, we bring it to City Council for the blessing of City Council. And then after that, we'll release our RFP for funding. So that's been our general process. But again, with everything happening with COVID, we've just been at a standstill. And then of course I had a baby, and so that also kind of pushed things back a little bit too. So
yeah, congratulations. It's good to see you, and welcome back.
Thank you. Yeah.
Okay, so that's helpful. And I guess I had some other questions for the folks from Aspen Solutions. I think this is where they're directed. Kira, point me in the right direction. When you're doing the results-based accountability and you're trying to determine the universe that you're dealing with, we talked a little bit about the census. That isn't really helping you rely. You're not really relying on census data. I mean, are you then dependent on who you're going to be funding to understand the universe that you're measuring of a particular demographic or people that you're serving? Does that question make sense?
So perhaps, Madam Chair, the population level priorities that are selected are archival data, such as chronic disease rates, depression, drug overdose, suicide. Those kinds of things are what tell us what are those needs and those emerging priorities in our community at the large scale level. And then we can break it down by different demographics in many cases to see which groups are at higher risk. And we also get that information from our community providers to identify how to meet those most at risk and those most in need. I'm not sure if that gets at your question.
Yeah,
or
yeah, that's helpful. And I guess, and you talked a little bit about, sort of the challenges that have been presented as a result of the pandemic and the impact that it's had on across the community in many different areas. And I guess, we're hearing sort of anecdotally and maybe not so anecdotally, the stress on youth and increases in suicide rates and, just kind of distress otherwise. And just curious, I mean, given the structure of the commission and the funding and the focus, like how do you pivot and to deal with that specifically as we see maybe that area rise in to a level that really we've got to do something to address.
Yeah, I mean, I think more resources are needed in our state and in our community for behavioral health for sure. But the agencies that the city is funding did just incredible swift work to make their services available virtually, to provide bilingual services for sure. I think the other thing that we saw is agencies figuring out how to meet those basic needs, even if it's not falling within their normal scope. They figured out how to get food to their clients or refer them to agencies for rental assistance. They're great networkers and collaborators. But I don't know what else, to say about the behavioral health needs, because I think we do have a higher need than we have available resources for currently.
And I guess, I mean, as you look for 2021, certainly the impact the pandemic has had will be prevalent on the mind and the focus as the strategic plan is developed or tweaked or rewritten for 2021.
Madam Chair, if I could add, and maybe Julie can elaborate, we have two things come to mind in terms of the ability to pivot, and respond. One is that the kinds of contracts we now have with every agency are deliverable based contracts that are based on navigation. And so that's a very broadly determined, broadly defined term that gives them funding to help people in the way that they normally help people, asking them to do so within a somewhat unified framework. But it's a loose form. It's a loose enough form to pivot within, I think. We don't hold them rigidly to, these performance measures. They're sort of a temperature taking or a weather taking. But what we're asking them to do is just help people with safety net services. We know that's what you want to do. Here's a way to do it that we hope is flexible. The other thing is that as Natalie said, the city funds, which are, close to 3 million every year for safety net services, are not enough to address the safety net services needs. We're not the only funder. Obviously, the county is funding heavily, but we also hope to do this in a way that attracts funds from other funders, from foundations, from states, so that ultimately the city is not solely responsible for the Connect network, for example. And then Julie, do you want to talk about the innovation contracts and the innovation funding, which do allow a little more flexibility?
You just read my mind, Kira. I'm only back for a few weeks and we're like right there. So one of the things that the commission created in the last 2 years was a small grant innovation fund. And really that fund is made available to every nonprofit in the city, and it's to be used for innovative and flexible projects. And so when communities see needs outside of what the city or the county or the foundations are funding them for, they can apply for this as a response to something going on in the community. A really good example is youth shelters had a need for grieving groups for their homeless youth. And so Gerard's House was a nonprofit that applied for the Innovation Fund to start doing after hours small grieving groups for the homeless youth staying at the emergency shelter. And so that's a way that a nonprofit was able to identify a need, apply for a small amount of funding, and then be able to fulfill that need in the community. The Innovation Fund generally goes out after July 1st, but again, because of the delays and COVID, it's something that hasn't been put out publicly. But the funding, because of the governing body and because we're able to keep our budget stable for the Children and Youth Commission funding, we're able to release an innovation fund this year, which I'm sure will be, a lot of our proposals will be because of what's happening with COVID and how programs have to rethink delivery of service. And so I've had a number of emails from folks saying like, we completely had to redo our service delivery model, but we can't pay for Zoom licenses. Is this something the Innovation Fund could cover? Absolutely. We've had to do virtual tutoring and our foundational grant isn't going to cover that. Will the Innovation Fund cover this? Absolutely. So it is something that we have available that could be in response that is flexible. The grant application process is incredibly simple. The reporting process is really simple. We really wanted to make that fund be as available to nonprofits as possible.
Great, that's very interesting. All right, and then I want to go back to the Aspen Solutions people again. Sorry, I'm hopping around a little bit. You talked about national questions that sort of guided your work and having some, or guiding the, I don't know, can you go back to that slide? Do you know what I'm referring to? There aren't flexibility, there wasn't flexibility because the questions are developed nationally and yeah, here we go, data. And so I guess I just want to confirm, so, and there's no ability to do anything to capture or measure locally.
Definitely we do, and that's why we focus a lot on the agency performance levels measures, and they do often use similar questions on their own evaluation tools or questions that measure directly what their services are getting at.
Okay,
so we do that at the agency level. Mhm.
Okay. All right, good. Okay. I think that was all the questions I have. I just want to thank you all for being here tonight, for spending the time and helping us, better understand all the work, all the good work that's going on at the city level to help address the needs of our community. And I think this is really important. And Julie, welcome back, and glad you're here. And yeah, just thank you.
Thank you so much.
Kira, is there anything you want to add as we close this presentation out?
Madam Chair, councilors, no, thank you. Thank you for your wonderful questions and your interest in the work. And again, if we look to this as a potential model for how we all at the city define quality of life and how we want to hew towards certain goals, I just hope you keep Aspen in mind as a great resource for that kind of thinking. And maybe we can have some offline conversations as well as how we can continue that and sort of scale it up, because I think it's really helpful.
Great. All right. We will then move on to matters from staff. Jennifer, do you have anything?
I do not. Thanks.
All right. Matters from the committee. All right. I don't see any hands up. Matters from the chair. The only thing I have is to tell us that our next meeting is October 7th. And thank you all for being here tonight and for all your great questions. And we'll see you tomorrow night. We're adjourned.